All right, so I'm going to talk about our surgical paperwork that we have here. So we always make every patient a surgical folder. On top of the surgical folder is the preoperative questions. So if they've had any food after 11 o'clock last night, if they take any medication on a regular basis, any health issues, food allergies we're not aware of, do they have their own medication, what are they bringing into the hospital? The next couple things we have here is our anesthesia monitoring form as well as our client consent form. So on this, they all have individual stickers up at the top that talk about the patient. So today we have Phineas, the canine, 11-month-old Labrador Retriever, yellow, 63 pounds, coming in for a routine neuter. He has no known health issues currently. So our consent form details everything out line by line. So when I go over with the client, I point out line by line and say, Phineas is going to have a preoperative exam. The doctor is going to go over him head to toe, make sure there's no health problems today. We'll do an IV catheter for fluid therapy as well as quick venous access throughout the procedure if we need it. We'll run preoperative blood work that looks at all of his organ function as well as complete blood count to make sure he's clotting and oxygenating himself and doesn't have a high white blood cell count. Today, Phineas is also due for a heartworm and tick-borne disease test, so we're going to recommend that as well. He's going to have an injection of a pain and anti-inflammatory medication called Rimadyl. Anesthesia with monitoring. He'll be under for about a half hour. We'll be monitoring his vitals the entire time. The neuter itself for a large dog, we'll do his nails and ears at no charge while he's under. He'll go home with Rimadyl, the pain and anti-inflammatory medication, do the operation setup fee down here at the bottom, and then lastly his inpatient accommodations or his nursing care while he hangs out with us. The other form would be the anesthetic form. So this is not yet filled out. The doctor will go through and put in all of his pre-anesthetic drugs as well as the drugs he'll use to induce the patient, any antibiotics. The technicians will fill out the temperature, pulse, respirations, mucous membrane, the CRT. We'll also put the BUN, creatinine, and glucose, and if he's had any medications in the past 24 hours up here. We'll fill out date, weight, who the surgeon and anesthetist is, what procedure, what ET tube we use, as well as what catheter and where we place it, what position the patient will be in, and we mark that we did a leak test and opened up the pop-off valve again. In terms of actually monitoring the patient, we use this graph here. So every 5 minutes, we're going to monitor heart rate, respiratory rate, SpO2, systolic and diastolic, as well as map blood pressure, and then temperature record every 15 minutes. We also do the isoflurane levels up here at the top. We record any suture material or blades the veterinarian may use if they're going to go home on any additional medications. We document what time they start the procedure and the anesthesia, as well as when they're extubated, when the procedure ended, as well as the amount of fluids that they had. So I'm going to talk about my patient's permanent medical records here. So we do use the Avamark system here. So I can log in, and the patient that I was talking about earlier that we were admitting to the hospital, this is his permanent medical record. In here it details out everything he's had in the past, from exams, vaccinations, to different medications he may or may not have taken. In terms of previous medical records, we also scan those into the system, which come up with this nice green line here, which is saved as an attachment, and then we scan in everything that we've had from the past. If there are any obvious chronic medical issues, they pop up as an alert here, which Phineas doesn't have anything. And so that's our permanent patient medical record. So these are the cage cards that we use here in our hospital. So they are dry erase, so we can write on them as patients go in and out. So today, like we talked about earlier, we have Phineas, this is his first name, Klosek is the last name. We have 11-month-old yellow lab, 63 pounds. He's here today for a neuter, and our doctor is Dr. Daniel Kelly. So again, we make sure that the signalment as well as the procedure is on here to ensure that every proper patient is getting the proper procedure that they are scheduled for. So this is our treatment board here. So on here we put the doctor, the patient, and the client's last name. We put signalment, yellow lab, and the reason that they're here or the procedure they're coming in for, which is a neuter, and then their discharge time. The other permanent or proper identification we use for our patients are these disposable collars, where we write their name on them and actually put it around the patient, so that way we ensure we have the correct patient and we're doing the correct procedure. These are our laboratory forms here. So on this we record the date, the pet's name, the patient ID number, whether we're running an in or out blood work, and the test that we ran, as well as the results got to the doctor. The owners were contacted and they were downloaded into the medical record, and the staff member that was running the test. And then, so today, Phineas is having a preoperative screening and chemistry 10, as well as the complete blood count to ensure that he's healthy enough for anesthesia for his neuter. We're going to discuss discharge instructions for Phineas's neuter. So he is going home on a medication. It's Rimadyl, which is a non-steroidal anti-inflammatory drug. The 75 milligram tablets. Instructions are going to be give 1 tablet twice a day for 5 days, starting tomorrow morning, because he had a 24-hour injection of it while he was here in the hospital. Side effects to watch out for with that medication are mostly just gastrointestinal upset, so make sure that he's still eating, make sure there's no signs of vomiting or diarrhea. Exercise restrictions, so for the next 14 days we want Phineas to stay pretty quiet. No unleash running or unsupervised play for 14 days. Dogs generally don't know how to self-monitor themselves very well, so if they do too much activity, we can develop something called a seroma, which is basically a little pocket of fluid around the incision site. The other thing that's possible of happening is the incision, the suture line actually breaking down and opening back up, which is never a good thing. Dogs definitely need to be kept an eye on to make sure they're not licking or chewing at that back area there and trying to remove the sutures themselves. So some dogs do require an e-collar, so I'm going to send you guys home with the traditional e-collar, the plastic cone to go over his head to make sure that doesn't happen. He can eat his regular diet when he goes home tonight, but definitely give him a smaller meal because anesthesia can sometimes upset their stomach. So give him a smaller meal to start, and if he's still hungry, you give him another little one before bed. Same thing goes with water. Incision care, like I said, take a peek at that incision twice a day. Make sure there's no signs of redness or swelling or discharge. If there's any concerns at all, just call us right away just to make sure that we're on the right track. Suture removal, he doesn't need his sutures removed. We used absorbable, and they'll absorb on their own, and there's special tissue glue on top. We did apply a microchip as well to Phineas today. So I'm going to properly restrain Lily here for a jugular drop. So I have my legs nice and square so her bum can't move anywhere, and I'm going to hold her head at about this level so my technician can come in and occlude the vein and draw her blood. So we're going to demonstrate proper restraint for a cephalic blood draw from Lily. So I'm going to hold her head with one arm and grab and occlude and roll the vessel with the other arm and hold her right like this while they draw the blood. So the last restraint I'm going to do for Lily here would be for her saphenous vein. So what I'm going to do is I'll get her to stand up for me here. What I'll do is I'll pick her up with one arm, hold her head with the other, and come back with my other hand and actually occlude her vessel with this hand. So that way someone could come back and draw some blood out of her saphenous vein. All right, I'm going to demonstrate placing my canine patient into a kennel and then taking her back out. So I do have her on a slip lead here. So I'll go ahead and open the door. She'll want to come in. As soon as she goes in, I'll grab the slip lead and pull it right off and close the door behind her. Then to take my patient out of the kennel, I'll make sure my slip lead is ready to go. I'll ensure she's ready. I'll open the kennel door again. We'll slip this slip lead right on, and she'll come right back out. So I'm going to demonstrate how to safely apply a muzzle to one of my canine patients here. So I have the properly selected muzzle size. What I'll do is just quickly place it over her muzzle and go back and clip behind the ears and tighten it up to just till about it's perfect. And now she has a muzzle safely applied to her. Good girl. So I'm going to demonstrate how to properly apply an e-collar onto a canine patient here. So I have properly selected the size. I already have some rolled gauze which is strung through it, and I've made sure that it will fit over her head. And what I will do here is I'll gently slip it over her face and make sure that her ears come through. And then I'll take my rolled gauze. It's okay, sweetheart, you're fine. You're okay. And tie it up into a nice little bow, quick release bow, so I can take it off if need be. And now that I've got it all secured on there, I make sure that I can fit 2 fingers in there and twist them to ensure that it is not too tight. We're going to do a complete physical exam prior to Gus's neuter today. So I'll check him over head to toe, starting at the face, looking in the eyes, checking CRT, which looks perfect. I'll peek in his ears and look all over his body for any signs of any abnormalities. I'll feel his belly for any signs of obvious masses. Gus is a young, healthy kitty, 11 months old, no known health issues. Does have some skin irritation on his tail, which we'll definitely have the veterinarian take a peek at. I'll have Jamie, my restrainer, come over here and hold him so I can do the TPR. Start with heart, listening on the left side. I'll count for 15 seconds. Beating about 200 beats per minute. I'll listen to the other quadrants here. Respirations are at 35. Lastly, I'll take his temperature here. All right, bud. Temperature's 100.4, so everything falls within normal limits. We'll give Gus an ASA grade status of 1. He's ready for his neuter. So I'm going to perform a complete physical exam on Miss Lily here before her surgery. So I'll start at her head, and I will take a look in the eyes, peek at those teeth, and look at the capillary refill time, which looks great. I'll go over, peek in the ears, and just go head to toe and feel her all over for any abnormalities or growths, lumps, anything like that. She'll stand up for me. Again, I'll feel all over on her belly as well. Everything seems to check out great. So the next thing I'll do, I'll listen to all 4 quadrants here and take a TPR. So on her left side, I'll count for 15 seconds. I get a nice whole number of 30, which brings to 120 beats per minute. I'll go over, listen to the other quadrant. I'll listen to the lung fields. Again, I counted respirations for 15 seconds. She is breathing a little bit quickly, so I'll write down my TPR of 130 beats per minute, which is 63 respirations. And then I will go ahead and take her temperature prior to surgery here. Insert the thermometer in her rectum. I'm sorry. Just wait till I hear the beep. She has a normal temp of 101.5. So everything pretty much falls within normal limits. So I'm going to give her an ASA grade of 1. And she is ready for anesthesia. So we're going to demonstrate a back leg blood draw. Jenny is restraining my patient. I'll go ahead and include the vessel with the tourniquet. Then I'll go ahead and wet the vessel with alcohol. I'll go ahead and puncture the vessel. Okay, then we're going to come out. Alright, so I'm going to do a back leg blood draw on my kitty here. So I'm going to wet my vessel with alcohol here. I'll go ahead and puncture.
Then you're okay.
Alright, so I'm going to do a blood draw here on my canine patient out of her cephalic vein. So my restrainer's holding off. I've palpated the vessel. I'm going to insert the syringe and aspirate the blood back into the syringe, coming out, and he's going to hold off. And then I'll place the blood directly into the tube. Alright, so we're going to do a cephalic blood draw on my feline patient. So once I've located his vessel, I'll wet it with a bit of alcohol. I'll insert the needle. It's okay, buddy, it's okay. I'll draw back and get the blood that I need. I'll go ahead and come out. And he's all set. I'm going to do a jugular blood draw on my canine patient here. So I've located his vessel. I'll go ahead and insert the syringe, aspirate back, and Jenny will hold the spot right there, and I'll place it into my tubes. Alright, so we're going to do a jugular draw here on this feline patient. So I've located my vessel. I'm going to puncture. No, good, hold off. I'm going to go over to my tubes here. So I'm going to talk about our minimum database for our young, healthy patients that are coming in for routine procedures. So the minimum database is a PCV, total solids, blood glucose, BUN, and ALT. Here we do perform a complete blood count in addition to those things, as well as a Chem 10 that includes creatinine, BUN, creatinine ratio, sodium, potassium ratio, the chloride, total protein, albumin, globulin, ALT, and ALP. In terms of additional tests, if we find any abnormalities, young puppies that have vomiting and diarrhea, running a fecal and a parvo snap. Next step obviously be radiographs, abdominal ultrasound, and ultimately exploratory laparotomy if it was that indicated. If we notice a heart murmur on the preoperative exam, we recommend an echocardiogram or an ECG. If there's a cancer diagnosis, we always do thoracic radiographs prior to proceeding to removing a cancerous mass. If there's elevated BUN creatinine, we recommend a UPC. If there's any form of anemia, we typically do a vector-borne disease test, usually an ELISA, SNAP-4Dx, or a FLEX4. And those are just some of the things that we can do in addition to our minimum database for our patients if they are any abnormalities on the minimum database tests. Alright, so I'm going to discuss a pre-anesthetic protocol for our patient Phineas who's being neutered. So our pre-anesthetic protocol that we're going to follow today, we're going to use a combination of ACE-promazine, butorphanol, as well as atropine. So we're using ACE today for the sedative effects. We're using butorphanol for, again, the sedative effect. It's a mild anxiolytic, as well as the analgesia that it'll help provide. The last thing we use is atropine, which is the anticholinergic, which helps reduce the secretion, so it's easier to intubate and all of that sort of thing during surgery. We also do an injection of Rimadyl, which is a non-steroidal anti-inflammatory drug to help reduce inflammation as well as help control some of the pain. We'll induce using an IV anesthetic called propofol, which is ultra short acting. We like it because it helps get the patient to the next stage of anesthesia so we're able to intubate and then maintain with isoflurane. Also has a really short half-life, so it's quickly out of our patient once we're maintaining with isoflurane. Once we have him intubated, we will hook him up to the anesthesia machine and maintain throughout the entire surgery with isoflurane. When he's done, we'll disconnect and let him recover. I'm going to make an entry into my controlled drug log here. So this is a mock log, but this is exactly the sheet that we use. We do keep it in a binder filled with all of the in-hospital controlled drugs that we use. So today we'll be recording some phenobarbital. So we have the bottle number that we pull out of, the drug and concentration, the amount of tablets that were in it originally, lot and inventory number, as well as manufacturer. So on here, the first thing that we do is record today's date, the vial number that we're pulling out of, the patient's name, which today we're recording for Jake, and the account number, which is on the drug label here. The amount used was Jake is getting 90 out of a 1,000 count bottle. There'll be 910 left. The technician's initials, which is myself, and the ordering doctor, which is Dr. Daniel Kelly, and then the total shift used, or the total amount used within the shift. And that is the log. Alright, so I'm going to talk about my anesthesia machine here in parts. So the first thing I'll talk about will be our oxygen supply. So you can see the green line up here comes all the way down and is piped into the machine. So that's our oxygen supply, which actually there are two big tanks over on the other room next door that supply the oxygen. The next thing I'll talk about is our flow meter. So the flow meter is controlled by this little valve here. This controls the amount of oxygen that's going to our patient. The next thing I'll talk about will be our O2 flush. So this can quickly flush oxygen through the machine. Next I'll talk about the vaporizer, which turns the anesthetic liquid into a gas that can go into our patient. Next I have the unidirectional inspiratory valve, which allows movement of gas only one way, which is to the patient. I have my corrugated tubing in the wide piece. This is going to allow gas to go from the inspiratory valve to the patient, and then gas expelled from the patient to the expiratory valve. This here is the rebreathing circuit, so it does allow some of the gas that was exhaled through the patient to go back into the patient again. Next, I have the unidirectional expiratory valve, which is here. Again, allows gas only one way, which is travel out of the patient. Then we have our adjustable pressure relief valve. It's a pop-off valve. When it's open, it prevents pressure from building up in the machines in our patient's alveoli. It can also be used to determine flow rates, like low flow when we're using a lower flow rate. It can also be used to prevent breathing if we're bagging the patient manually. And then we have the manometer here, which shows the amount of pressure in the machine and our patient. We also have our rebreathing bag, which allows the patient to rebreathe some of the gas exhaled. It also allows manual ventilation if we need to. We have our CO2 absorber down here, which is the SodaSorb, so that absorbs CO2 exhaled from the patient. It has a pH indicator in it that helps know when we need to change it. And then lastly, we have our scavenging system, which is back here. It is a passive scavenging system. It's the F-Air canister. So what we do with this is we record the starting date as well as how much it weighed in grams, and then we replace it after 12 hours of anesthesia use or a weight gain of 50 grams, whatever comes first. And it is an active charcoal system. In addition to that, I have my mask up here, which we do use to induce some of our exotic patients like birds and some other patients if we need to use the mask. So this would go directly over their face or the entire head if possible, and then they breathe the anesthetic gas that way. The other thing we have up here would be my induction chamber. So the induction chamber is very similar, except the patient will actually go inside of the induction chamber. We do use this for some of our exotics and fractious patients that we can't touch. And we just hook up the machine to the valves out here. And that's it. Alright, so I'm going to perform a leak test on my anesthesia machine. So the first thing I did is I did connect my oxygen hose over there into the local oxygen source, which I turned on in the other room. I attached the circuit that we're going to use, which is our larger rebreathing circuit. We're going to be testing our 2-liter rebreathing bag here. So I'm going to securely occlude the end of it with my thumb. I will completely close this pop-off valve here. And then the next thing I'll do is press the fast flush here, and I'll keep an eye on my manometer until it reaches 40 centimeters. Now that I've reached 40, I'm going to keep a close eye on it to look for any signs of change, which it does not look like it's moving. So the next thing I'll do is go ahead and not take my thumb off of the end of the rebreather, but open up my pop-off valve. And it looks like my rebreathing bag has deflated here. So the next thing I'll do is I'll remove my thumb from the circuit end. I'll look at my scavenging system to make sure there are no leaks. And everything looks great there. And the last thing I'll do is completely open my pop-off valve. So I'm going to discuss my non-rebreathing circuit. So this is a little bit different. It actually bypasses this part here by being hooked directly into the vaporizer and O2. So it goes from this tube into this, which is hooked into the patient, and then the scavenger system is on the bag, which is attached to the F-Air over here. We use this system for patients that weigh 3 kilograms or less. I'm going to discuss my ET tube here. So the first thing I'll do is I'll measure to make sure that it fits perfectly from the tip of his nose right to his thoracic inlet, which it fits pretty much perfectly. I'll also ensure that it is not leaking, so I'll go ahead and inflate the cup and make sure that it's not leaking, which it's holding air very well. So this is an adequate cup. This is our respiratory monitor that we use in surgery, so it has the nice wave here of our respirations as well as it counts the respirations per minute. To demonstrate gastric intubation, I would use a mouth gag if needed to, but she is intubated, so that makes it nice and easy for me. So I'll place this in her esophagus, and I'll advance until I am where the gastric intubation tube needs to be, and she's all set. So I'm going to hook my patient up to her monitoring equipment. So the first thing I'll start with is my SpO2 that measures the amount of oxygen in her red blood cells. I'll take the infrared side and put it to her tongue. The next thing I'll do is the thermometer probe, which I'll grab the end of and place down just next to my ET tube. I'll take my EKG monitor. The thermometer probe obviously takes her temperature. EKG looks at heart rate, rhythm, and electrical activity. So the white probe goes on her right arm, and then we do the red probe on the left, left rear, and black probe on the left arm. Grab my alcohol, I'll wet the leads. And then I'll take my pressure cuff and measure, make sure it is accurate. And then I'll go ahead and place it over the vessel without being too tight or too loose. Blood pressure measures systolic and diastolic, and also does it mean arterial blood pressure. My esophageal stethoscope, which I will put on and again place next to my ET tube. And I'll place it in the esophagus. Until I can hear her heart. And she's all hooked up. I'll start monitoring.
Dan Kelly, Alex's mentor here at Stonecliff Animal Clinic.
Alright, so I'm going to place a lateral saphenous catheter here. It'll click all around the vessel. Next thing I'll do is scrub. And I'll do a 3-time scrub unless my third one is still dirty. Now that I have blood in my hub, I'll go ahead and secure her catheter. It's okay, sweetie, extend. Pretty sure. Oh. Stay right like that. Now that our catheter is secure, I'll place my T-set. And I'll ensure it's patent by flushing. flush nice and easily. So I'll go ahead and bandage. So we're all bandaged and good. I'll flush it one more time just to double check the patency of my catheter. There we go. Lateral saphenous catheter has been placed. Alright, so I'm going to place the catheter in my canine patient in his cephalic vein. The first thing I'll do is put his spur right up here. So I will start with my chlorhexidine scrub, starting in the middle and covering the entire leg. Moving forward to my alcohol, same thing. And again, my chlorhex. And then again, alcohol. And my third chlorhex. And I would repeat if it was still dirty. So my assistant Jamie is going to hold off that vein. I will grab my catheter, have it all ready to go. I'll place my thumb just next to his vein without actually touching it. I will advance the catheter bevel up into the vein until I see a flash, and then advance the catheter forward. Jamie will let up. I'll place my plug here. And then I will begin to tape it in, secure it. In our protocol here, we secure with a bunch of pieces of cloth tape. Now that I have the catheter secure, I'll attach my T-set. Which I will again secure here. Lastly, I will use my vet wrap to bandage distally. Wrap it around. Lastly, I'll secure my T-set to the vet wrap. And I will ensure patency by flushing and feeling proximally up the leg. Insert my plug. There we go. And I can feel it distally up his vein. So my catheter is secure. Alright, so we're going to demonstrate a subcutaneous injection on my kitty friend here. So here's his pre-medication of Hydro Ace. So I'm going to inject, pull back, make sure I don't get any blood in the syringe, and depress the syringe. Alright, so we're going to demonstrate an intramuscular injection today. So I'm going to go into his back leg. I've located his muscle with one hand. I'll insert the needle in the other. I'll aspirate back just to make sure I don't get any blood in the syringe, and I don't. And I'll depress the entire contents in. And he's all set. Demonstrate doing an IV injection into her catheter. So I'll put the needle in and go ahead and slowly put the entire contents into her vein. Alright, so I'm going to induce my patient via IV anesthetic, so we're using an ultra-short acting anesthetic called propofol. So I've already placed this catheter. I'll go ahead and titrate this to effect.
We have the pit.
Can you give me a minute, Doc, real quick? On the drinking dog, I'll get some strength. Okay, and then I'll get a Virgo, I'll go through that.
Alright, so Liam's going to hold up his head for me.
How much
I'm going to use my light here to visualize the larynx. I'll push up dorsally on the soft palate until I can visualize the glottis. Then I'll go ahead and insert with a twisting motion without forcing it
You got a
in.
gown on?
I'll get it all the way in. And then I'll go ahead and tie it perfectly. Like this, with a surgical knot on top. I'll hook them up to oxygen. And then what we'll do is I'll go ahead and plate the cuff. You can look over, Liam. And I'll plate the cuff. Liam's going to hold off my pop-off valve and reservoir bag. Go ahead, Liam, hold off the pop-off valve.
Is that going to be knocked out?
Yep. And I'm watching my pressure rise. And once we're at 20, I'll listen for any leaks. And it sounds good, so Liam's going to let up.
What's wrong?
at all. He asked
And I'll
us
place some
to
lube
send
into
him
his
to
eyes.
This was the only puppy in the litter. It was
I'm going to palpate Jake's bladder here, just to verify that it doesn't need to be expressed prior to surgery. And I would express if needed, but his is also. I'm going to clip and scrub my patient prior to surgery. So he's having a mass removed off of this section of his body here. So the first thing I'll do is clip all of his fur around where the doctor's incision will be.
Do you need any wider margins, Jamie? Maybe a short over even.
Alright, now that I've removed all the fur, I'll take my chlorhexidine scrub, start in the center, and do circular motions outwards. And rinse with alcohol. And I'll do that 3 times or until it is completely clean of fur. This is a pretty dirty area, so I think we'll be doing it many times. Now that my last chlorhexidine scrub is free of any debris and fur, I'll do my last alcohol, and we'll move him on our gurney into surgery here. Maintain our sterile field here. And we'll slide him over onto the table. Perfect. And then we'll secure him to the table in dorsal recumbency. No. And then we'll do our final scrub prior to our veterinarian coming in. So again, starting in the middle, doing circular motions outward, and our final rinse with alcohol. Alright, Sammy is ready for surgery. Alright, so I'm in here monitoring my patient that we're taking the tumor off of. So every 5 minutes I'm recording his heart rate, respiratory rate, SpO2, systolic, diastolic, and mapped blood pressure, and I'm recording his temperature every 15 minutes. I'm also recording where our isoflurane levels are at, as well as the fluid rate. I'm going off both my Cardell monitor as well as my own judgment. Alright, so I'm going to demonstrate CPR on my dummy. So what I'll do is I'll place my hand, and my hand's like this, right over where his heart is, and then I'll do 100 beats per minute, so it just looks like this. And then the other thing I'll demonstrate would be the ambi bag. So if we were to use this, it would go over the ET tube like this, and then I would depress the entire bag, and it's at a rate of 10 to 12 respirations per minute. So we're going to do a complete surgical scrub using our AlvaGuard system. So the first thing I'll do is dispense one pump into this hand, and then I'll dip my fingers into it, get it underneath all the nails, and then work downward, making sure to get all surfaces of the hand, as well as all the way up to the elbow. And then I'll do the same thing for the other hand. Again, dip my fingers, get it underneath my nails, and all the way down my hand. And I'll dispense one more into this hand, and again hit all aspects of the hand, and forearm up to just about the elbow.
But everything went great. I'll be around. Did they set you up with
And then I will allow my hands to dry prior to my gown and glove. When my hands are dry, I'll put on my gown by grabbing just the strings here, pulling it up, and letting it fall without having it touch. And I
If you don't
will
have the sling, it's not a big deal. I mean, going upstairs, we definitely say assistants.
slide my arms
do it on their own.
into it here.
And either we have slings or it's something, you know, to get through it,
And
they get that other
Sophie
one.
will go ahead and tie me in.
Towel, you know, wrap towel, that's what we're using here. Or you're gonna have to take one of the reusable grocery bags and just cut the sides down, and then you get your handle and you got a sling right there. And that works out well. But the towel will do well. I think she's gonna do pretty well three-legged. She's gonna keep lean. You've done a great job keeping the extra weight off her. And she seems pretty fit. So I think she'll do okay.
Alright, then I'll go over to my glove,
Yeah.
and I'll place
You're
the
gonna
glove
need to keep an eye on that in the immediate full stop.
on my hand like this, the glove, and go over my hand like this. And I'll do the same thing with the other hand. Again, placing it like this, and going over top, just as I did before on the other hand.
Let me show you what to do if that happens again. So just find them. You can go to records. Do that. View records. Am I going too fast? Okay. View records, highlight it, and go transfer results. And then it should let you transfer. Oh, there's another way I have to go.
Alright, now that I have my gloves on, we'll move over into surgery. Go ahead and get it set up, and my trays organized here for my patient. The scalpel blade, Molly. Scalpel blade. She won't be over there, it'll be in the... my surgical pad. So I'll go ahead and load the scalpel blade on using my needle driver and scalpel holder. And here is I'll grasp and slip it into that, and my scalpel blade is ready to go. I'll place this here, ready for my surgeon. And the next thing I'll do for my towels, bring them over to my patient over here. Alright, so then I'll go ahead and drape her using my 4 towels. First towel will be closest to me. On this side. Placing it just like that. Place this towel just like that. Usually place just like that. Just gonna go on my patient like that. I'll grab my towel clamps. Clamp it through the patient's skin. Take my drape. Give it a nice administration. Take my nicely fenestrated drape. Place, Molly, I'll need those big towel clamps, please. My last towel clamps. Clamp this to the towels that are underneath. My patient is ready for her spay.
Scalpel. Herb Kelly. Good, Mayo's.
I'm going to care for some exposed tissue. So what I'll do is I'll take my isotonic solution directly over the tissue and squeeze some liquid out right on top of it to keep my tissue nice and moist while we're performing surgery. I'm going to promote hemostasis here by blotting the exposed tissue. So I'll take my sterile gauze and give it a good blot. And Dr. Kelly will continue with surgery. So I'm going to discuss the duties and responsibilities of a sterile technician. One of the biggest things is maintaining sterility, accepting sterile packs from the circulating nurse, setting up a table and draping a patient, passing instruments to the surgeon, tissue care, as well as promoting hemostasis by blotting any exposed tissue if the veterinarian asks us to. Suture can be loading onto a needle holder, cutting the edges, running suture on a continuous pattern, and also recognizing the pattern that the veterinarian may be using. One of the biggest things, like I said, is maintaining sterility, and if that sterile field is broken, it must be reported immediately. If you break a glove or anyone breaks a glove, then we can replace those gloves, and depending on how bad the break was, then they may have to re-scrub. If an instrument is dropped, it can be rushed out and done a flash sterilization or perhaps grab a new instrument. And those are the main duties of a sterile technician.
We have not had a cat spay scheduled here for the last couple weeks, so he hasn't been able to assist in one per your requirements. But in his time here over the last 2 years, he's assisted in many cat spays, both anesthetically, prepping, and assisting in surgery. So I think that should fill his requirement.
All right, so we're in our canine routine neuter procedure here with Dr. Dan Kelly. All right, so I'm in here on my routine spay procedure with Dr. Daniel Kelly. I'm the anesthetist today, and I'm recording her vitals every 5 minutes.
See if they can figure out what we're doing here.
I hope they can.
Today.
Right. All right, so today we're neutering our feline patient here. Dr. Kelly's performing the surgery, and I am monitoring. And I'll record his vitals about every 5 minutes. Doing okay?
You don't get to record very much in 5 minutes, do you?
That's okay. All right, so I'm going to demonstrate a post-surgical cleanup here. So the first thing that I'll do is come over and organize all my instruments. The doctor already took care of her sharps, and there was no biohazardous waste today. So go ahead and get everything all organized and throw away any extra suture or gluture material that has already been used, any gauze that's now dirty. So I'll throw that into the trash. Now that I have all my tools back onto the pack, I'll close it up, set it outside of surgery I'll clean it up after I'm done sterilizing the facility. So I use my Rescue Disinfectant, which has a contact time of 5 minutes. So I'll go ahead and spray it all down here. The table entirely. And the bottom of the table as well, on all sides. I'll give it 5 minutes and come back to do that. In the meantime, what I'll do is sterilize all my leads, take off any ties, and put them in the wash section. Unplug the table. I'll get my isopropyl alcohol and sterilize each individual item, starting with the esophageal stethoscope. Wipe off any debris here. Throw that away. Thank you, Ray. My ECG leads, I'll wipe off individually here. Make sure to get any debris off of there and wrap them up nice and neatly. The same with the SpO2. Filling the entire thing with isopropyl alcohol. Put it all back together here. Wrap up nice and neatly. Same with my thermometer probe. I'll wrap that up nice and neat. Alright, so now that it's been 5 minutes, my rescue has had sufficient contact time to disinfect. I'll wipe down the surface entirely. Including the front of the bottom of it. Open up the tray. Go ahead and wipe that down entirely as well. Now that my surgery table is all clean, I'll go back to my instrument table and wipe that down entirely. Alright, so the next thing that I'll do is I'll go through and I will wipe down all the other surfaces in the room which includes our little instrument table over there, the anesthesia machine. I'll wipe down the walls as well as the lights and the windows in the room as well. I'll sweep in here and then do mopping, and then the room will be ready for our next patient. All right, so I'm going to clean up my surgery instruments after surgery. So what I did is placed all of them into my pre-soaking bin that had a little bit of the detergent in it. They sat for about 5 minutes, and now they're ready to go to the manual decontamination. So I'll open up all the locks and place them into my other bin that has warm distilled water as well as more detergent. The next thing I'll do is I'll take my soft bristle brush here and manually remove any debris. Alright, so now that I have all of my instruments all decontaminated, the next thing I'll do is rinse with distilled water. And I'll bring them over to dry on a lint-free cloth until they're ready for the ultrasonic cleaner. Alright, so now that all my instruments are dry, I'll place them into my ultrasonic cleaner. And then I'll turn on the cleaner, and we let it run here for 10 minutes, and I'll be back with the next step. One of the last steps I'll do now that they've come out of the ultrasonic cleaner is rinse them with distilled water and get all of the contaminants off of there. And lastly, I'll place them out to dry, and once they're dry, if they need any surgical lube, I'll place it on there, and then I will wrap my pack. Alright, so I'm going to wrap my surgical pack here. I have all my correct tools on the inside. I close it up. Our protocol is we use 2 wraps, and I'll take the bottom side and fold it up and over, leaving a courtesy tab for my veterinarian to grab, and this side comes over and again back. And then this one will come over and back again.
I just heard a really good line from a father to a son.
And then I'm going to take this and put it here and back over. And then same thing on the other side. Back over. And then that's going to come up and over this way. Tuck it in. I'll take my surgical towel, which will go on top, fold it back for my veterinarian to be able to grab easily, and then repeat the same exact procedure with my outer wrap. So again, over and back in, making sure it's nice and tight. Any dead space will leave room for contamination. Back over again. And this side, over. And fold it back. And then this side will fold over and back. Same thing on the opposite side. And then this will come all the way over. Make sure it's nice and tight. Fold it up and in. Tell me that tape lid. Thank you. And then, once I'm certain that it's nice and tight, I'll take my steam indicator tape and put 2 pieces, one on the bottom and one up top. And then we label here with date, content, so surgical pack on 6/20 and my initials. Now I have a nice neat surgical pack that will go into the autoclave. So I'm going to wrap a gown according to sterile procedures here. So the first thing I'll do, I'll lay it out with the outside facing on the out. I'll go ahead and take the sleeves and straighten them out here. Next thing I'll do is take the outer edge and fold it in halfway. Get it nice and straight. And do the same thing on the other side. And then I'll take this and I will fold it up and over. And I'll take it and fold it accordion style all the way up. And I'll make sure that these are accessible to my doctor, so when they unwrap it, they're able to go ahead and grab it and stay sterile. I'll take my sterile towel, place it on top. Grab my wrapping material, place it right up here. I'll take it up and fold it over, just like I do with my surgical packs. I'll follow the same protocol in the diamond shape. On this side, up and over. Take the top half, fold over on each side, bring it up, and tuck it in. Get it as tight as possible and grab my steam indicator tape. Place one strip right over the top. And I'll go ahead and label with today's date. That says large surgical gown and my initials. Now it's ready to be autoclaved. So this is our autoclave here. It is a gravity air displacement autoclave. Essentially what it does uses distilled water at the bottom of the machine here that is heated electronically until it's turned into steam. Steam is forced through a port in the sterilizer, and then the steam pressure builds until the temperature is reached. The temperature it uses is between 250 and 270 degrees Fahrenheit. Pressure is between 15 and 27 pounds per square inch, and it runs for 15 minutes to ensure sterility. In terms of steps in using one, you open it up, you place what you need in there, you select the different cycles. So we have our unwrapped, our pouches and packs, as well as our hand pieces. We select that and press start, and the machine does the rest automatically. We're talking about packing an autoclave here. So the biggest thing to ensure sterility is to making sure that the outside of the packs do not touch the inside of the chamber, so that way steam is able to reach them and sterilize them. So today I'm going to put two items in there. They're in their pouches. So we have the dental pack as well as our dental elevators. So I'm going to place it directly in the middle on top of our vented little rack there, and then same thing for the top. Again, ensuring that none of it is touching the inside of the chamber, which it all looks perfect. I can close my autoclave, select my pouch cycle, and press run. All right, so for the monthly maintenance, what we do is we actually take this and we drain all of the water in the reservoir there. We take an ounce of Speed Clean and place it directly on the bottom here and run the pouches cycle. Once we've done that, we refill this again with distilled water and do the unwrap cycle, and then we actually stop it before it goes through the drying cycle. We make sure to get all of the trays and wipe down the tray rack, as well as clean any filters or anything along those lines. We take out the gasket and clean this door here with the gasket, and then we also verify that the pressure relief valve is in good working order and clean all the parts in there. In terms of how we know it ensures sterility is we have our steam indicator strip that will change to this black line color once the temperature and steam pressure has reached, as well as inside there is a steam indicator strip that changes color once we know it is completely sterile. So the doctor will double check this, as well as when he opens up, he'll look at the sterility strip before he does anything else with the pack. All right, so we're going to do a suture removal on my patient Dino here. 11 days ago, he had a tumor removed from this side of his body. So in terms of ensuring healing, I'm going to check over and make sure there are no gaps in the incision site, which everything looks great. Look for any signs of redness, discharge, and everything looks perfect. So it's a simple interrupted pattern. So with my non-dominant hand, I'll use my forceps to grab the suture, and in one motion I'll snip and pull out. And I'll do that for each individual suture until all of them are removed.